Was there anything that caused you to want to be a psychologist?
I had a strong desire to want to help others and to continue to have meaningful conversations with other people.
What is your favorite thing about being a psychologist?
I learn something every day. I have meaningful interactions that support change and goal accomplishment.
How long have you been in this profession?
Almost 30 years.
What are some of the mental disorders that you deal with?
Anxiety, depression, hostile acting out, communication challenges between couples, career planning and development. I also train other therapists to do the type of methods and use the theory that I use.
Are some of those mental disorders harder to diagnose than others?
Yes, they are.
Are there times where your job is more stressful than others? If so, what are they?
It is stressful at times to maintain balance in different types of cases. I do not have too many life threatening cases, which do require more structure than I can sustain over a period of time.
Do the situations you hear about ever bother you?
Oh, yes. Whenever I hear about a parent talks about hitting a child, or whenever someone doesn't have a choice about where or with whom they live, and talk about being in an overly compromising situation.
But is there a certain age group you like working with more than others?
This changes across my own life stages. Currently, I love working with young women that are the same age as my daughter, who are aware of many options and who claimed their world to citizenship. I also love to work from a faith-sensitive, spiritually oriented way when clients want us to do work with them in that manner.
As a psychologist, do you try not to get emotionally attached with your patients?
I do try to do that, but I do like to be emotionally available and resonant, but not attached.
Some treatments for patients, and how do they help the patient?
Well, I help my patients explore their authentic experiences, their feelings and thoughts and beliefs in the present, and then they collect their new information that helps them make new and informed choices about their behavior. They reduce their defensive patterns, and then that helps them move toward their goals.